Hi everyone and welcome to blog 48 of Tackle the Feelings Before the Behaviour. And my name's Paula and today's blog is going to be called Anxiety and Autism Spectrum Disorder Symptoms Can Present in Similar Ways. So I'm doing this because I'm quite passionate about this little confusion that seems to be happening. And I say little confusion, but it's having a very large impact, especially in the communities I work with that I can see. I'm working in Melbourne, Australia, but I think speaking to people, I've got networks around the world, as you do when you travel, and it seems to be a very common thing that's happening, and it's creating so much fear and upheaval in parents. It's a frightening thing to think your child has autism or ADHD or something along those lines, and because that's a lifelong thing. And even if they do, it's what do you do with that? And if you haven't noticed these symptoms that the child cares and the kindergartens and preschools or whatever you call them are alerting you to, it can be so overwhelming for parents, and it really can affect parenting, and it can create anxiety. So this blog is by no means going to cover this whole topic. I wanted to start getting this out there because it's just been so present in the families I'm seeing at the moment, in my personal life. I think it's just something that I feel really needs to be expressed and really needs to get out there accessibly to people, to parents in particular, to know that anxiety has very similar presentations to autism spectrum disorder. I'm not calling it autism because it's on a spectrum. So to start with, when I'm talking about anxiety, I'm not saying anxiety disorder in terms of that. Really, people think OCD, people think the mental health disorder that's really, really bad. But truthfully, we all have a level of anxiety, and we name it stress. We name it overwhelm. We name it fear. So anxiety, when it gets to that level, is when there's an excessive amount of fear. There's an excessive feeling of threat, that something's going to harm you. And often when it's anxiety, it's perceived. It's a perceived threat. So it's not necessarily that there is some cloaked, daggered person outside your window ready to kill you and your family, or that fright that you get in a horror movie, or that, feeling nervous walking down a dark alleyway. Those are very healthy, normal reactions to fear. Anxiety is usually stemmed from our childhood trauma, and we all have it. This isn't to bash parents, because the world is so unsafe when we're little. And when we don't get our emotions regulated, we don't have a level of emotional safety. So depending on the child's temperament, on your experience, on experiences, on family values, on other environmental factors, children get impacted in different ways. But anxiety in children is pretty much a given, because they are dependent. If you are, as a person, dependent on somebody else and don't have that inner fortitude, that inner strength, that ego strength in yourself, you are most likely going to be anxious too. Because if that person takes away the support, or they're not with you, or the connection breaks, you're going to feel very unsafe. You're going to feel untrusting of yourself. You're going to feel anxious. So that's anxiety. Autism spectrum disorder has a certain amount of anxiety in it, for sure. But this is a developmental issue. And I will post in the comments the number, if you are in Australia, for AMAZE, Autism Australia. It is a really good helpline that you can call and ask your questions, because this is a big issue, and this autism spectrum disorder requires some professional help. It requires an assessment process that is quite a stringent assessment process. And so if you're being told by one practitioner or a school teacher or something that the child has autism, do not think that is the be-all and end-all. Even professionals miss this, get it wrong, because they don't have the full story. When they do autism assessments, A.S.D assessments, there are about 3 practitioners. It's a long process. It's a very stringent, thorough, evidence-based process. And at the end of it, you may think it's autism and realize there are just some delays, or there's something else going on, or it's separation anxiety, or something along those lines. So it's worth going down that route. It's an expensive route. If the functioning of your child is really difficult to manage, they're really struggling in certain areas, they're not making friends, all that kind of thing, it might be worth checking out. I'm not saying don't check it out and lump it into anxiety. I want to get your cogs turning a little bit about these symptoms and hopefully ease your worries when things start happening for your child, if they start happening, or if someone's pointing them out you haven't noticed and you're worried about it. So AMAZE Australia, or AMAZE Autism Australia, define autism as a developmental condition that affects, among other things, the way an individual relates to his or her environment and their interaction with other people. So basically this affects 3 areas broadly, where you will often see sensitivities in sensory sensitivities, so that's noise and different textures and things with the senses. They don't like bright lights or things like that. You also have sensory interests, so you get odd behaviors. You get some strange, repetitive, odd behaviors, different languages that come out, flicking things a million times, all that type of thing. I see weird and wonderful things, and no 2 people present in the same way. No 2 children are the same. You cannot box them. That's why they've given it such a broad category called Autism Spectrum Disorder, because everyone's on a spectrum. And the last thing could be intellectual impairment and learning disabilities, which is often what sparks the kindergartens in schools, that with behavioural issues, or these weird behaviours, inability to focus, all that type of thing. So I'm not going to go into it too much, but this is developmental. So this requires a whole separate way of working with a child. It's going to require a lot of tactile, visual stimulation and learning. It's going to require a different way you talk to the child. You're going to give time for them to process what you're saying. You're going to work with reports. You're going to work with professionals to know how to best help your child and support your child. And you will need to know if your child's high functioning or low functioning and all that type of thing. So autism spectrum disorder is something that needs to be handled professionally in some way, shape or form. Often requires a lot of support for parents. You're not supposed to know what to do here. It's good for you to get help. So I've taken a long time to explain those 2, but the similarities come in with those 3 things I said. With anxiety, you can have odd behaviors. You can have very strange behaviors, especially separation anxiety. You can have children go into complete shutdown and overwhelm, into a catatonic state. You can get children being very aggressive, looking like they've got ADHD at home, but catatonic at school where they're just not moving and they just sit there withdrawn. They can be the other way around. They can not focus at all. They can seem like their sentences just break off. I've seen a little girl who changed her sentence. We didn't get through a whole sentence before the topic changed at least 3 or 4 times. And I was convinced as a professional that this may be A.S.D. I sent her down a pediatric route and realized it was severe separation anxiety. And it really got me thinking that if I can mistake this, when I am not in there to assess for A.S.D, I'm in there to work with things like anxiety, with parenting problems. I work on parenting issues, and I've got a mental health background. So my role is to prevent mental health issues developing in children later on into adulthood and all that kind of thing, early intervention. So when I mistake these symptoms, I realize just how complex and how similar these 2 things are. You can have a lot of sensory issues because anxiety affects the stomach so much. It affects the physical body so much. It creates a lot of avoidance. This need for control, this bossiness, this need to contain, this hiding away, this not wanting to go to kindergarten, school, or even to your grandparents' house, or not wanting to do anything, having problems in the car, not being able to sleep properly, wanting to co-sleep with you, being really clingy with you. Separation anxiety is possibly the most common with A.S.D symptoms, autism spectrum disorder, A.S.D, because it's the child just can't cope without the person they're dependent on. And that's usually the mother that I see, because the mother often is home with the children a lot more, that type of thing. Often if there's not much support in the home and you have to do everything with your child, that can create a dependence. If you've got anxiety yourself, that can create a bit of a dependence. If the child's just a sensitive child, and I've done my previous blog was on sensitive children, there are a lot of sensitive children with high levels of empathy. So they're picking up all the emotions around them. They're picking up everything. And when you're in anxiety, if you know this as an adult, I've got anxiety and manage it and have had to heal a lot of it myself, you'll realize that when you're anxious, you're scattered. You can't think properly. Your physical body takes over and your mental, rational brain sort of shuts down. And that's a survival thing. It's actually very biological that we do that. But that's why mindfulness and calming down is so important. And that's what we teach children as well, because you need to get back into that mental space so you can self-soothe yourself. And children need that from you. But instead, we're pathologizing children. We are giving them labels. We are setting them up for a fail in a way, because we're not saying, here's how we can help you feel safe emotionally. It's okay. And saying that I love you, you're safe, reassuring them, using your tones of voice, your body, physical affection, utilizing strategies to increase that connection that they are craving from you. They are craving a connection to feel safe. So how can you do that? That kind of thing. How can you help them to feel connected to you even when you're not around? How can you allow them to do more for themselves and gain a sense of independence? Help them to soothe themselves, because you cannot be with them 24/7. And that's what happens. And you see those extreme examples of presentations, usually when there is quite a bit of trauma. And it could be emotional trauma. It could be just about anything. You know, it doesn't necessarily have to be physical abuse or sexual abuse or something like that, although you're going to get some severe behaviors from those types of things too. Usually a lot of acting out and a lot of problems when it's severe abuse. But when you're in a family where emotions just aren't spoken about, they aren't regulated, where your feelings are often dismissed, where you're shamed a lot for having reactions, for having an opinion, for speaking out, for being yourself, for making mistakes, all that type of thing. If there's problems in the home, if there's unprocessed grief in the home, all sorts of things, and that's life. But that creates a lot of anxiety in children. Anxiety often comes with transitions, new siblings, moves, changes of school, teachers leaving, losing a friend because they move away, all that type of thing. There's a lot of changes and transitions that happen for children, creates anxiety. If we leave this unmanaged, or if we punish and shame, fear-based parenting is the #1 shamer that can happen here, that creates anxiety, because we equate sort of that love and that care with punishment. We equate that relationship with the relationship turning. So that developmental relationship between parent and child, the parent's so loving, they love you, they tell you they'll never leave you, they're perfect in every way, and then you do something naughty because you're learning, because you're making mistakes, because you don't know how to do it differently, because you're pushing boundaries, you're trying your best to get attention because you need those needs met, and you get a spank, or you get put in the naughty corner and isolated and humiliated. And that creates such a shame. So we're doing a lot of this, and this is just an introductory to this. I would like to make a blog for professionals on how to recognize these symptoms a little bit more, how to ask questions, how to talk to parents, because that is really important. I do a lot of that in my job, in seminars and in one-on-one sessions with families. And I really think that it's worth exploring and just getting the cogs turning, that it might not be developmental, it might be situational, it might be something happening, and that's a good thing. It can be turned around with the right support. So I hope that's been helpful. Have a great week. Bye.